So hello everyone, this is Sumit Kamal from College Dunia. Today we are at B.G. Patel College of Physiotherapy, located in Anand, Gujarat, and we are having with us Dr. Dipti Padole, Associate Professor, Physiotherapy. Good afternoon, ma'am.
Good afternoon.
So firstly, ma'am, we'd like you to introduce yourself.
Hello everyone. Myself Dr. Dipti Padole. I'm working here as an associate professor. I have been attached with this institute since 2001, and since then, in this last 20 years, our institute has grown up to a great extent. In initial times, it was just a UG course, but eventually over the years, we started up with the post-graduation course, and also we had tie-ups with certain private hospitals across this Anand district. So that gives a good edge, a learning experience to our students on practical side. Whatever they see in books, whatever they learn in theory, that same thing they get to see on the patients. So that makes their task much easier. And for us also, it becomes easy for them to correlate the symptoms, whatever they learn into the patients.
So, alright, ma'am. So, ma'am, we'll be jumping on to a questionnaire session. So, ma'am, my first question to you is, how do you try to bring practical approach towards subjects and make it industry oriented?
I am a HOD of musculoskeletal department. So these days you must be listening about a lot of people, young people of just say 30-40 age group having a lot of neck pain, back pain. So the actual problem is about the disproportionate furniture or the work ergonomics, right? So the ergonomics is an upcoming branch. So we focus the patients not just from the symptoms point of view, but also from the furniture or all the accessories that they use in their day-to-day life. So we teach the students that how to analyze this patient, that is the CHOP analysis. So that what is the height of the chair, seat, say a simplest example of a computer professional or a housewife. So what kind of work she has to do, what all daily course she needs to do. So those detailed assessments we teach the students and at the first level, and after the treatment, once the full assessment is done, we plan up the whole protocol. And as per the protocol, the treatment session goes and is reassessed at regular intervals. And after a certain interval, when the change is seen, the students get to know that yes, this technique is working onto the patients. So that helps to actually learn from the practical point of view.
Alright, ma'am. So, ma'am, my next question to you is, what are the best practices offered by the department which help them gain the required skills?
Since our institute is located very close to the local bus stand, so that has an access for people or patients from all over the peripheries across Anand district. So that becomes a very easy for them to travel from their own village to the Anand district and to our department. So since we have patients from all pockets, rural pockets of Anand district, we have a great variety of patients that the students can get to see. Also the rates, the treatment that are offered are at a very reasonable cost. So even poor patients, they can avail these facilities compared to the private sector. So where the private sector, the costs are very high. So here we the patient rates are very cheap, reasonable, and also we do offer certain needy patients, that is the patients with BPL card. So such patients, they are given free of cost or partial costing of the treatment. So that helps to improve the patient's physiotherapy services across the Anand district.
Alright, ma'am. So, ma'am, now we'll be jumping on to our next question. So, ma'am, how does Physiotherapy department of the college prepare students for higher education?
At regular intervals, we have a just a minute. Is that one? Okay. We have a very good bonding of our students right from the initial stage. That is the moment when they come to the second year. We make their groups groups of second year, third year, fourth years, interns, and PGs. So each and every student which is coming at second year level, he is being mentored from hierarchy, right from the PG faculties, PGs, fourth interns, fourth year. So that group formation that helps to make a good bonding amongst them. So this bond helps to go through in all the successive years. Also, when they pass out, they are in touch with the students. Also, we have certain activities, or we have online, because of COVID. Now it has been possible to have certain webinars online so that they can interact with the senior students, and we have activities which helps them to bridge a gap, bridge a gap between the students, right? And the students which are already abroad, they guide the next students, upcoming batches, and they also help in the paperwork, and they guide just like an elder brother or sister to the juniors.
All right, ma'am. So, ma'am, my next question to you is: when you came to the college, what was your vision, and how are you trying to achieve this?
20 years back, when I joined this institute, this was just a 3-year-old college. So that time, our goal was to make it the best and provide services, physiotherapy services. And also in those times, since it was the first college, the motto was to make the people aware about the physiotherapy services. And the Physiotherapy Institute is there in this location. Otherwise, people from Anand, previously they had to go to Ahmedabad or Baroda for physiotherapy service. So that was quite costly those times. Apart from the treatment cost, transportation cost used to take a lot of toll on the patients. And even the students, students, they had to travel all the way to south for admission. So that started getting students started getting focused into colleges in Gujarat, and that made awareness.
All right, ma'am. So, ma'am, at the end, I'd like to ask you that what valuable advice would you like to give to the students for them to have a prosperous career ahead?
First of all, I congratulate all the students, those who come to physiotherapy, because they have chosen this profession. It's a very noble profession. It's a profession which has a good combination of making fit themselves, at the same time making a good rapport with the society and giving back to the society by their health services. Also, this has a very good prospectus abroad, and even now here in India, there are good awareness programs. So the students should always be grounded with the theory and try to work as hard as possible so that they will get good returns in the long duration.
So thank you, ma'am, for giving us your time. That was such an informative session. We surely have a lot to take away from here. Thank you, ma'am.
Thank you.